for New Westminster.
Thank you, Honourable Speaker. Imagine waiting 2 years in severe pain for a hip replacement. That's what Anne Morris from Salmon Arm is going through today. She's one of 3,000 people in British Columbia on a wait list to get a new hip. Anne first saw her surgeon in October of 2013, Honourable Speaker, and she was told that her surgery would be a year to 18 months down the road. Now she's told it will be at least 2 years, Honourable Speaker. That's because her surgeon can't get enough operating time in the Vernon Jubilee Hospital. Does the minister think it's acceptable for Anne to wait 2 years in sometimes excruciating pain to get a hip replacement?
Minister of Health.
Thank you very much, Honourable Speaker, and to the member for that top 5 question. It is something on the minds of many British Columbians, and when you are in pain, when you're waiting for surgery, it is a long time sometimes, Madam Speaker, because there's a challenge in some areas of British Columbia particularly. On average, British Columbians, in terms of wait lists, are about middle of the pack across Canada. That's not good enough, Madam Speaker. We've identified that a year ago in our priorities document for the healthcare system. We've put a team together led by Dr. Andy Hamilton, the Provincial Surgical Executive Committee. They're looking at ways of optimizing the system to further reduce wait times, Madam Speaker. We'll continue to do the work to make sure British Columbians get access to the surgery they need when they need it.
For New Westminster on a supplemental.
Honourable Speaker, people like Anne Morris and others like her are not looking for excuses. They need action on unacceptably long wait times in British Columbia. Anne Morris and 3,000 other people like her are waiting in pain and discomfort, some of them on morphine, some in such severe pain that they are now confined to wheelchairs, as a result of callous decisions by this government. And not only that, they're paying more for health care while they're getting less, Honourable Speaker. It's not acceptable. Anne is 78. She's a full-time caregiver for her husband, who suffers from COPD. She's worried that her own pain management and her increasing lack of mobility will mean that she'll no longer be able to care for her husband, who will then probably have to be admitted to care. Why are Anne and other people like her having to pay more for health care while getting less and languishing on wait lists because of callous decisions by this BC Liberal government?
Minister of Health.
Thank you, Honourable Speaker. Thank you, Honourable Speaker. We've made some great strides, actually, when you look back, Madam Speaker, over the last 12 years of this BC Liberal government. We have increased the number of hip surgeries by 90%. We have increased the number of knee replacements by 138%, the number of cataracts by 50%, the number of angioplasties by 34%. Madam Speaker, we've taken the wait times for hip joint replacement from 19.6 weeks down to 14.6, 25.3 weeks for a knee joint replacement to 18.4 weeks. Madam Speaker, talk about decisions. This is the group across the aisle here, Madam Speaker, that didn't train one extra doctor in the 90s. We'd have 1,000 more doctors in British Columbia today had they done what we had done, Madam Speaker. That would have gone a great way to reducing wait times in the province of British Columbia.
Hear, hear. Member for North Coast.
Honourable Speaker, Interior Health is transferring laundry services out of its hospitals. The Director of Support Services says the decision, quote, isn't about the efficiency of our operations. What he does say about it is that it's about not wanting to spend money on replacing old washing machines. Honourable Speaker, public or private, British Columbians will be paying for those washing machines. The issue is these jobs could end up leaving British Columbia. There is not a good reason to send these jobs to Alberta. Why is the Health Minister allowing this to happen?
Minister of Health.
Thank you, Honourable Speaker. Quite in a very concise way, I'll say they'd rather spend those on hip replacements than on washing machines.
Member for North Coast on a supplemental.
175 jobs could be lost in Kelowna, Kamloops, Nelson, Vernon, Penticton, and in the Caribou. And again, there's no guarantee that these good-paying, family-supporting jobs are going to stay within British Columbia. The Health Authority is following the mandate of the provincial government, whose preference is to privatize more and more aspects of the healthcare system. Considering that the Health Authority is clearly satisfied with the efficiency of the laundry services, why is the Liberal government insisting that they eliminate these good, family-supporting jobs?
Minister of Health.
Thank you, Honourable Speaker. The health authorities and the ministry are very consistent. We want to get the very best deal for the taxpayer, Madam Speaker. That is very consistent. And quite frankly, Madam Speaker, doing laundry, washing bed sheets is not health care, Madam Speaker. We want to make sure we get best value for the dollar. I know the way the members opposite ran healthcare, they might have thought that was healthcare. We think healthcare is looking after patients to make sure they get their hip replacements in a more timely manner, Madam Speaker. We're going to get the best deal for the taxpayer, and laundry is not healthcare. We want to put those dollars in frontline healthcare for British Columbians.
Member for Nelson Creston.
Madam Speaker, only a Liberal would think that cleaning and taking care of our hospitals isn't health care. This plan would see 17 family-supporting jobs.
Members, the chair will hear the question and the answer.
Madam Speaker, this plan would see 17 family-supporting jobs lost in Nelson. Jobs that are integral to Kootenay Lake Hospital and it running efficiently. And it's not just Nelson, Madam Speaker. Penticton, the minister's own riding, Kamloops, 100 Mile House, Williams Lake, all are about to see family-supporting jobs shipped out of their communities. Minister, taxpayers are going to foot the bill for these services regardless of who's doing them. So let's do them in our communities, and let's save on the shipping costs. So my question is to the minister, will he commit to that today?
Minister of Health.
Thank you. Madam Speaker, I get the point, and I certainly don't want to leave the impression that the work being done by people that are doing laundry service isn't.
Members. Members. Minister. Member. Please continue.
Thank you, Madam Speaker. It's obviously an important service, but it is not frontline healthcare, Madam Speaker, and those jobs are going to be staying in British Columbia, Madam Speaker. We're looking for efficiencies. The members opposite talk about making sure that we are doing more with our dollars to make sure we get best value for the taxpayers. Madam Speaker, in healthcare, the only way we have managed to reduce the cost increases and make the healthcare system sustainable is to do things more efficiently.
Columbia River Revelstoke.
Thank you, Madam Speaker. The only way we can make the system sustainable is to increase efficiencies so that we can do more hip surgeries, we can do more knee replacements. Madam Speaker, the Interior Health Authority had discussions with their unionized employees about ways of reaching those efficiencies. Unfortunately, they could not come to an agreement, so they are going out to an RFP, request for solutions, actually, Madam Speaker, to see what the mix will be. But at the end of the day, the desire is to get the most for taxpayers so that money can be in frontline health care.
Thank you, Minister.